In this video, we're going to learn how to troubleshoot your autoinjector. The autoinjector is what we use to help with the intracavernosal injections. When patients are having difficulty doing the intracavernosal injections, one of the things we need to troubleshoot is the autoinjector. Remember, this end of the autoinjector controls the depth of the injection. If I twist back on the autoinjector, you see more letters of the alphabet showing up. What that means is that the actual injection is more shallow into the penis. We typically set the autoinjector at the B, as in boy, level. That's the correct depth for 99% of guys' penises. If you look at your autoinjector and it's set different than that depth, you want to twist the autoinjector to that level. Again, if you're at the A level or higher, the injection is going deeper than we typically want it to go. So the first thing to check is that the autoinjector is at the B level for boy. When we set the autoinjector, the device is spring loaded. The first step in the process is setting the spring. This is done by pushing the yellow piece of the autoinjector into the device or using this end of the autoinjector to push the yellow piece in. Once we've pushed that in, the black piece will set out, meaning that the spring has been loaded. At this point, you would take your medication that you've drawn up into your syringe. You will drop it needle side down into the autoinjector. You will then thread the device together. There are threads on the blue piece of this edge of the autoinjector and the gray piece on the inside. Thread the device together, and at this point you are now ready to give yourself an injection. The problem with this autoinjector is there's a safety mechanism on the device. So if I push on the trigger now, the medication will not fire. The safety mechanism is this gray piece that says Autoinjector on it. I can slide this piece up and down very easily. In order to release the trigger and be able to fire the device, this gray piece has to be pushed down against this blue piece. When I push the gray piece against the blue piece, I can then push on the trigger and the medication fires. Again, when loading your autoinjector, make sure the device is set on the B level. Set the spring by pushing into the yellow piece. Drop your medication into the edge of the autoinjector, needle side down. Thread the device together. If you're having significant difficulty manipulating the safety mechanism, we do have a second autoinjector that we will make in the office where we glue down the safety mechanism with just regular glue. What that does is it prevents you from having to keep this closed manually. So the device is set, you drop your medication in, you thread the device together, and all you do is press the button. If you feel like this would be a better option for you, please let Dr. Warner know.